Presenter is Dr. Elliott Attisha. He is the Associate Medical Director of our school-based and community health program. Dr. Attisha completed his pediatric residency at Children's Hospital of Michigan, and he practiced for about 9 years in the ambulatory setting. In 2010, we were very fortunate that he joined Henry Ford's school-based program and community health program, which operates 8 school-based clinics in the city of Detroit. And each of these centers plays an integral role in alleviating the barriers that children in Detroit have towards getting optimal health care. Soon after taking that job, he actually helped pioneer a yet even more innovative approach, which was the creation of a pediatric mobile clinic. So this is a clinic that's in a beautiful van, which brings all kinds of technology and expertise and staff directly to the schools. And this program actually allowed us to spread our services to even a broader footprint or cohort of schools in the city of Detroit. And recently, Dr. Attisha has begun to pursue yet a new endeavor to help improve the care that is received to patients who have asthma in the inner city. And asthma has become a particular challenge in the inner city, not only because there seems to be a disproportionate share of that disease in the inner city, but it's also more difficult for those patients to get access to high quality care. So Dr. Attisha is designing a new mobile solution called Breathmobile, and he will be taking that to Detroit school children in the near future. So with no further ado, let me turn it over to Dr. Attisha.
Thank you. So it sounds like I'm doing all of that. It's really not me. Thank you, though. It's a team effort, and really I'm just a big troublemaker. So, but for the right reason, right? So some of you have already heard I've had a no good, bad, horrible day today, and so if I'm a little off, it's the wine. So I met Kendra just over 5 years ago. She is, at the time, she was 12 years old. And she was brought to our clinic because the nurse noted that she had asthma, and so she asked me to see her. And I put my stethoscope on her chest, and I didn't hear a single sound. It was as if I was basically listening to a wall. But she sat there, just like each of you, not in any distress. She was so used to her lungs being so tight for so long that she no longer knew how to breathe, how to take a deep breath, nor did she know what it was like to take a deep breath. And so we gave her 2 breathing treatments and we gave her steroids, and she actually started to sound better, and I started to hear air going through her lungs, and she even smiled when I asked, how do you feel? So we gave her prescriptions for her asthma to help bring it under control, and then I asked the nurse to bring her back the next week, and so that I could follow up. And luckily, she made it back. But when I listened to her chest again, I didn't hear a single sound. It was as if I was listening for the first time. And so I asked, what happened? Aren't you taking your medication? She said, our family doesn't have a car. We couldn't get the prescriptions filled. Her family, similar to roughly 25% of Detroit families, doesn't have a car. And so making it difficult to get to the pharmacy, to get to the doctor. So we know that low-income and minority students are at increased risk for health problems. When it comes to asthma, inner-city kids are roughly 2 to 3 times the risk of having asthma than a child from the suburbs. The reasons are many, whether it's genetic, whether it's allergens, whether it's environmental. Also, recently, we're seeing a lot of attention around the psychosocial stressors and how those are contributing to the development of asthma. Estimates are that there are over 20,000 kids in Detroit with asthma. And those are just the ones that we know about. Yet due to existing barriers, including transportation, many of those kids don't have an ongoing relationship with their provider, which leaves them without the medications to keep their asthma under control. When you add the fact that most Detroit neighborhoods are health professional shortage areas, and most of Detroit schools do not have a school nurse, that basically leaves most of Detroit's children struggling to meet their health needs. So it's no surprise that Detroit children are 3 times more likely to be hospitalized and close to 3 times more likely to die from asthma than children from Michigan as a whole. Asthma can undermine a child's physical health, but it can also undermine a child's emotional and mental health. There's a consistent association between asthma and depression, asthma and anxiety. And it also happens to be the leading health contributor to missed school days. Any guesses in the audience how many days are missed from school for just asthma alone? Doreen cannot answer this question. Any guesses? I'm talking nationally, across all children with asthma, how many days annually in a year are missed from asthma? Sorry, I should have clarified that. Just a guess. Total, all kids together. 10 million. 10 million, sorry, I phrased the question wrong. The wine. So of course that doesn't account for all those days that a child was up coughing all night, but still somehow gets to school and is now falling asleep, is now acting out, is now easily distracted, and is now being mislabeled with some other health issue, behavioral or otherwise. So asthma quickly became a focus of our program. It also became a passion of mine. And maybe it's because I suffer from asthma, or maybe it's because I see firsthand some of those struggles that these kids are going through on a day-to-day basis. Some of those struggles, some of those things that most of us take for granted. So we knew we were making a difference, but we also knew that we were barely touching the surface. If we wanted to reach more kids, we had to get creative and explore different opportunities. What if we redesigned one of our mobile clinics to just treat asthma and to go to schools in the city bringing comprehensive asthma services? Oh wait, it already exists. It's called the Breathmobile, except Detroit doesn't have one. Not yet, anyway. The first Breathmobile was launched in LA back in the mid-90s. LA's program started with 1 Breathmobile, and now they have 4, serving over 100 different schools. The LA program served as a template for roughly 10 other programs. And Doreen might jump up and correct me, sorry if I'm wrong, and please do, including Baltimore, Chicago, Phoenix, and many others. Their outcomes are pretty impressive. They've brought, after 3 visits, they're able to bring 80% of their asthma kids under control. They've reduced ER visits by 68%, hospitalizations by 87%, and missed school days by 82%. Sure, it's expensive. The average budget for each program is about $500,000. But when you look at their return on investment, close to $7, just under $7 for every dollar invested. So our hope is that Detroit will eventually have a Breathmobile, and thanks to a recent grant from Dresner Foundation, we were able to hire a coordinator who's going to help us develop and take us to that implementation phase. No pressure, Doreen. And I'd like to introduce Doreen, who is serving as that coordinator. So we're excited to have Doreen as part of the team. So the Breathmobile will be housed under the Global Health Initiative in partnership with Henry Ford's Department of Pediatrics, collaborating with different departments across Henry Ford, including school-based, allergy, public sciences, community health, equity, and wellness. And we're especially excited to be partnering with the Detroit Health Department, who will serve as an external partner on this program. Working closely with the Detroit Health Department, we spent the last few months researching existing programs, and we even went out to LA and Orange County to visit their programs. What happens in LA stays in LA. Sorry, my jokes are really bad. Due to current challenges in Detroit, our proposed model, though, is going to be slightly different than what those other programs are currently doing, or more of a slightly expanded version, I should say, including the addition of nurses or other program staff that would be assigned to a select number of schools because of our school nurse shortage. These individuals would be in charge of finding those kids with asthma, doing pre-visit intakes, doing case management work, doing post-visit education, coordinating referrals, and so much more, making us much more efficient and allowing us to touch so many more lives. We're also hoping to include a home visit component. And in addition, we plan to screen for comorbid issues, some of which include behavioral health issues and obesity, but of course not limited to those. So a Breathmobile proposal is in process, and once complete, then we'll hope to begin searching out additional support. And if all goes as planned, we hope to launch this program by the end of this calendar year. During the coming months, we'll begin to survey schools and identify highest areas of risk within the city. We expect to start with roughly 5 schools, visiting each on a regular basis, projecting to serve somewhere between 400 and 500 individual patients with about 1,500 visits a year. So the solution to Detroit's asthma problem is far from simple. Our work in Henry Ford school-based and school-linked health centers, including the mobile clinics, has taught us that schools are an ideal place, and Kate will vouch for this, are an ideal, and as will Michelle, and many others in the audience, that they're an ideal place to address a child's health issues, especially when it comes to poor and inner city environments. In 2016 alone, our school-based and community health program saw over 11,000 patient visits, treating close to 4,000 individual patients. At times, we've had to get creative in order to address some of the challenges. Kendra's struggle with obtaining medications was one of many similar stories that walked through our clinic doors. Thanks to the support of Henry Ford's ambulatory pharmacy, we were able to create a medication delivery program where prescriptions are sent electronically to the pharmacy, and they're delivered that day to the school where we're serving that patient. So we can give the medication to the child, and we can also provide education right on the spot. And to date, we've delivered over 5,000 individual prescriptions because of that program. Bringing care to the child means that the child doesn't need to miss school. It means the parent doesn't need to miss work. But most importantly, it makes sure that the child has the resources and the tools they need to create a healthy learning environment. We know we can't do it alone. We know that it takes a village. None of what we do is possible, would be possible without internal and external support. We've learned that through collaborations and partnerships that pretty much anything is possible. The Detroit Breathmobile is an opportunity for us to take our work to the next level, so that children like Kendra will no longer be hindered by their asthma. We hope you'll join us on this journey. Thank you.